I'm Dr Ian Strawford, and I'm the Medical Director of Skin Excellence Clinics. Would you like to find out more about Botox? How it works, whether it would work for you, when you should start having Botox, at what age, and what sort of conditions does Botox treat? Is it more than just anti-aging facial treatment? Can we treat migraines? Can we treat bruxism of the jaw? Can we treat the neck or other areas of the body? Can we help with depression and anxiety and chronic headaches? I'm going to answer all of these questions in the next little video, so stay tuned.
What is Botox and how does it work?
So Botox, quite simply, is botulinum toxin, which is a naturally occurring protein molecule that is produced by bacteria. And it works by blocking nerve endings to muscles. In simple terms, what that means is it paralyzes the contraction of a muscle. So it will relax muscles, and that's its primary purpose when we're using it.
What sort of patient would be suitable for Botox and why?
We see many patients in the clinics who are coming for treatment with Botox or botulinum toxin. Probably the most common reason for treatment is to reduce or to prevent lines and wrinkles on the face, especially the forehead, the frown lines, the forehead lines, and the lines called the crow's feet lines around the eyes. So these are what happens in the aging process, is that our muscles are active in what we call facial mimicry. So we might be smiling, frowning, all of these sort of movements. And over time, the skin will fold always in the same position, and lines and wrinkles will start to become etched onto the face. They become deeper. They move from being what we call dynamic lines to static lines. So we may be using our Botox to reduce and relax the muscles to stop that movement in the face and allow those lines and wrinkles to gradually disappear. Or perhaps in a younger patient, we may be using it to prevent the lines and wrinkles from coming in the first place. The other main reason that we're using Botox in aesthetics could be to lift the eyebrows, because again, the muscles of the face, the frown muscles will pull the eyebrows down, and the muscle of the forehead will lift the eyebrows. So we may be using selectively to try to raise someone's eyebrows to give what's called a brow lift, or to prevent the aging of the forehead actually causing the brow to come down. So we may be slowing that aging process down.
What age is a good age to start having Botox?
So the age when one could consider having Botox is we have to think about what is Botox used for. So in a younger patient, we may start having Botox treatment in your 20s and 30s, when there may be very little lines and wrinkles present. And it may be in that situation as a preventative measure to soften the movement in the forehead, to relax the muscles and prevent the lines and wrinkles coming, or to help slow down the aging process of the brow and the brow drop that happens. So in that case, we may be starting in the 20s and 30s, but it's never too late to start having Botox. And even if patients are coming in later life with lines and wrinkles, then having Botox may help reverse some of those age changes and also may slow down the aging process going forward. So we're using Botox regularly in our treatment plans with our patients when we're dealing with the visible effects of aging of the face. It can be very effective in the neck, where there is overactivity of the neck muscles, which often leads to lines, wrinkling, and even these bands called platysma bands, which creates laxity in the neck. So again, we may be using Botox as a preventative measure to slow down the aging and the skin aging, the visible aging, and the laxity in the neck.
Is Botox safe?
A lot of people worry about whether Botox is safe, and clearly it is a neurotoxin, which sounds like it should be very unsafe. But Botox is a prescription medicine, and it has been studied probably more than many other drugs that we use today. And it is used in all areas of medicine where we need to reduce muscle activity and muscle contraction, even used in children with spasticity problems, patients with eye problems, squint problems, but it's used anywhere now. So we know it is incredibly safe if it's administered in a safe way by a experienced doctor or nurse or surgeon, knowing the anatomy and knowing how that drug works.
What other conditions do you treat with Botox at Skin Excellence clinics?
So Botox has proved very helpful in lots of ways. It's obviously used for facial aesthetics, where we're slowing down the aging process, treating lines and wrinkles, maybe treating laxity in the neck. But other areas within the face especially, so masseteric hypertrophy, these are the big muscles, the jaw clenching muscles, and we can treat that. Now that might be presenting as a widening of the face. So often we will be treating the masseter muscles to shrink the jawline down, jawline slimming. But a lot of those patients with masseteric hypertrophy, it's often referred to by the dentists as bruxism, will be causing clenching of the facial muscles, which can lead to facial pain and headaches, but also can be damaging the teeth. We're often treating a lot of patients in our clinics for chronic headache disorder. So there is some good evidence, and this treatment is available in some areas through the NHS to treat very severe headaches, chronic headache disorder, chronic migraine disorder, and there is a specific protocol for treating headaches. We're also finding that, and there is again some good published data to show that actually treating certain areas of the face can help with symptoms of depression and anxiety, having a direct central effect on the brain chemistry. So there's some very interesting areas. So we're treating a lot of patients. We've been treating many patients with sweating disorders known as hyperhidrosis, especially under the arms, but on the face, the forehead, the scalp. These are patients who sweat excessively for really reasons when you wouldn't be expecting to sweating. And it can be very socially disabling for those sort of patients. So again, hyperhidrosis or sweating treatments is another reason we're using Botox in our clinic.
There are so many people offering cheap Botox treatments. Why should I have treatment at Skin Excellence clinics?
Botox, or botulinum toxin, has been used for many years now in medicine, and especially in aesthetics and regenerative medicine, where we're looking to slow down the aging process or treat the visible effects of the aging process. There are many people out there, many of them not even medically qualified, offering Botox treatments, maybe in hair salons or beauty salons. And they may have had very limited training in how to inject the Botox. And certainly they may have very little understanding of the facial anatomy, the muscles, the aging process. And what I see is when patients are having treatments, these cheaper treatments in non-medical professionals, is they may be getting inferior treatments because the person does not understand how they're using that tool and why. So they may be getting away with it, but often they're making the aging process worse. And I see many cases where the forehead is frozen, it looks very unnatural, they'll be exacerbating the brow drop. I see cases where they're injecting at the wrong depth or the wrong place, which could even affect the vision and cause double vision or and other areas. In the neck, it can even lead to swallowing problems. So it is a treatment that needs to be done. It's taken many, many years for me to completely understand how I'm using Botox and using it in a very skilled way with a deep understanding of the patient anatomy and their aging process. And everyone's different. So every Botox treatment is unique to that person as to how and why we're using Botox. So that's the main reason why you should go and see a medical practitioner who's experienced and knowledgeable, such as ourselves at Skin Excellence clinics.